So without further ado, I just want to present Roseanne Hountz. Thank you for being here today. I'm going to spotlight you. There we go. She's going to be our presenter, and I have a quick bio about her. She is absolutely amazing. She's been great and really awesome to work with in setting this up. So Roseanne, she received her diploma in nursing from the Good Samaritan Hospital and in nursing and her BSN at Mount St. Joe in Cincinnati, Ohio. She received an MSN in forensic nursing along with an MS in criminal justice, as well as her DNP in population health from Xavier University. She's currently working in nursing leadership at UCMC as the house supervisor, as well as adjunct faculty at Xavier University in the forensic MSN program. That's just a little bit about Roseanne. I'm going to let her explain a little bit more about herself as well. The floor is yours, Roseanne.
Hi everyone, I'm Roseanne, and I must have sent you the wrong bio. I actually left UC about 3 years ago. I am currently working in quality and risk management for Cincinnati Health Network, which is exclusively healthcare for the homeless. And but I also have my nonprofit, which is Josephine's Clinic, and we serve as healthcare advocates for sex trafficking victims. So that's kind of and all the people that we work with at Josephine's Clinic are 1, homeless, and 2, sex trafficked, and 3, there is 100% addiction rate. We don't have anyone who is not addicted to some sort of substance. So that's just a little bit about me. What we're going to talk about is sex trafficking, and we'll talk about sex trafficking as it kind of relates to the Cincinnati area or the Ohio, Indiana and Kentucky kind of tri-state area. Know that trafficking regionally looks different. It'll look different, a little different in Cleveland. It'll look different in California. It'll look different in rural communities, but there's still some essential things that'll be the same in identification. So we'll get started here. Trying to share it. It won't advance for me, Gage. Let me see. Oh, wait, let me try. Okay, here we go. So first we're going to define it. We're going to discuss a little bit of the research, kind of what you can do. It's also disguised a lot as a lot of other things sex trafficking is. So we'll talk about how it's disguised as other things. And then we're going to talk about trauma-informed care, because even though we're healthcare providers, I feel we miss that a lot. We miss the trauma-informed care part. So a lot of this might be difficult. So please, if you need to take a break, if you need to leave, is completely understood. So I just want to give you some examples of Cincinnati cases. Recent and some as far back as like 2012. So arrested in Mason, sex trafficking a 16-year-old. I find it kind of hard to see that someone only got 8 years. You know, somebody robs a store and they get 25, you know, so I find that really hard. This man actually had 2 14-year-olds. And actually got them out of their home through an app. They were from Indianapolis. He got them here to Cincinnati and was sex trafficking 2 14-year-olds. He was arrested in October. His case hasn't went to court yet. This man was over in Norwood, Avondale area, close to Xavier University. He actually had 12 women in this house. He got very little time. Only 1 person would testify, and testimony from a trauma patient, from someone has been so traumatized that it's very hard for them to come to court and show up in court. So we have a really low prosecution rate. This is this woman right here. That's her drug dealer. She actually sex trafficked her young daughter to pay for her drugs. And Shondell, who was her drug dealer, actually videotaped oral sex. And finally, the 12-year-old had enough of it and went to and told her parents, father and stepmother. April didn't have custody and she had visitation on the weekend. So for over 2 years, she was raped in order to get her drug money. These people were arrested, and red roofing is a big theme. I see red roofing a lot. You'll see it now after this. What happens often is women were trafficked, and then they get to be what I'm going to talk in vernacular of how they talk on the streets often is the bottom bitch or the bottom. So what happens sometimes, they may have been trafficked themselves, but then they get to be in the hierarchy. And in that hierarchy, you don't have to turn as many tricks and you don't have to do those things. So what happens is then you become the trafficker. And then unfortunately, what happens if caught, you are now the trafficker and you are now a registered sex offender. She was trafficking a developmentally disabled woman and got 8 years. This was Tim Nolan, our judge in Campbell County, who was trafficking. He was on the school board, so he was trafficking students. So that's just some of the area cases that have been going on. There's a lot of minor cases, and what I mean by that, minor children. So you don't see those in the news. So you don't see a lot of familial trafficking in the news, just because it's handled in a different court. So it's handled in family court, unfortunately. Here's all the different kinds of, I'm not going to go through it, but some of the big ones right now is organ trafficking. That's a big deal. We have 2 kidneys, people are trafficked a lot for their kidneys. But again, what we're really going to talk about is sex trafficking, solicitation, and prostitution. Although I don't really like those words, those are the legal terminology that is really used in our court systems. So sex trafficking and any kind of labor trafficking or sex trafficking, just know if you are any part of that chain of command, whether you drove them from the airport to the trafficker's house, if you were knowingly transported this patient or this person, you are guilty of trafficking. So any part of it, if you're involved in the recruitment, if you let them stay at your house overnight until the trafficker can pick them up, if you give transportation, any of those entities as part of the chain, you are as guilty as the person doing the actual trafficking. Why? There's lots of reasons why. Unfortunately, the biggest reason is supply and demand, right? Here in Cincinnati, we have we wouldn't have a supply if we didn't have a demand. And so a lot of things make people vulnerable, whether it's war, you see things going on in the Ukraine, globalization, it makes more people vulnerable. Transnational crimes, organized crimes, because you can sell guns once, you can sell drugs once, but you can sell a human being over and over and over. It's about $150 billion business. Right around 20 million people are trafficked in a year. Here's some statistics. It's a little old. I apologize for that. We don't have a lot of good statistics on trafficking victims. And I think it's because we don't ask, is kind of why. And I think we just don't know how to approach it. What do you do when they come to your ER? Someone has come in contact with 88% of the time had been in contact with healthcare at some point during their trafficking events. Any clinic, 51%, hospital ER, 63%. Violence is always part of trafficking. You don't have a willing participant unless you set fear into them. And fear is through violence, forced sex. They call it a train. And what I mean by that is they just line men up to repeatedly rape you. And then that gets your attention, right? They beat you up. And so unfortunate but true. And when there's drugs involved and someone is addicted to drugs, they're even more vulnerable. So we have lots of issues with drug addiction. As you can see, strangulation, huge. That's the best way to gain control of somebody, because at that moment you feel like you're going to die when you're strangled. So they are very cooperative from that point forward. Lots of sexually transmitted diseases, and that's really important as providers, right? Sexually transmitted diseases. If you have somebody who keeps coming in repeated and repeated and repeated, they're, you're doing, remember, you want to not only do urine and an anal swab, but you want to do an oral pharyngeal swab, right? You want to make sure you don't get a sore throat when you have a sexually transmitted disease, but you can still test positive. And if you're doing oral sex out there and you're not having vaginal sex, you're not going to get it on a urine. But I'm going to tell you, the two things that men out on the street want more than anything is anal sex and oral sex. And so that's why as providers, you got to be looking oral pharyngeal as well. Abortions, substance abuse, it says 84%. And I'll be honest with you, I have one in the people I help and the people I advocate for, I see 100% addiction. I don't have any folks that aren't addicted to some substance or multiple substances. Many people who've been out there 14, 15, 16 years, and I do have a lot of people that have been out on the streets that long, they will use any drug that they can get their hand on. And sometimes they use multiple drugs. Does anybody know what the term speedballing it means? Does everybody know that, or I'll explain. What they do is they will have to work for 4 or 5 days straight to earn enough money. So what they will do is speedball. So take a little heroin, a little fentanyl, a little something to take the edge off, and then they'll do, smoke a crack pipe. So they're doing an upper and a downer. So it gives you the ability to stay awake for days, but it also takes that anxiety edge off. So just some things. Really what your role is to know about it, be aware of it, and an assessment. And then kind of what do you do next? What happens when you find out somebody you suspect has been trafficked? So we'll talk about all those things. So like I said, it's a supply and demand. I don't know, has everyone heard about how the dark web plays into trafficking? Do we have anybody that knows? Well, the Navy created the deep web, and the deep web was created to capture nefarious characters and drugs and gun running and assassination attempts, all those kind of things. So what they did is they created the system that some really smart other people learned how to use it to their advantage. And you can advertise on the deep web. Well, now it's called the dark web, and they advertise the sale of people. They advertise, what ends up selling high on the dark web is disabled people. And I hate to tell you this, but the idea that someone is their captive earns lots more money. So that kind of thing goes on every single day. Social media, we see dating sites, social media, Snapchat, because it stays just for a few seconds, and you can advertise to a group of pedophiles easily using Snapchat, and it happens all the time. Boyfriends personal connections. You may know someone who offers you a job and you think you're going to a legit job, but it turns out that your job is first to deliver the drug. And when you get there, you think you're going to, you get a young woman who's 15 or 16 and someone says, I will give you $100 to deliver this package to this house. So what ends up happening, she delivers it because she needs the $100. She's got prom coming up. She's got things coming up. So she delivers the package. And then guess what? The 5 men in the home, they have paid to have sex with her. And she doesn't know that once she gets there. And so then she's forced to have sex with those 5, 10 men. The other is Romeo pimping and boyfriending. What happens is, especially young women, they meet somebody on Facebook who says, you're beautiful. You're the most beautiful person I've ever, and that's what every young woman, 15, 16-year-old who doesn't come from a loving home wants to hear, right? Someone thinks they're great. Someone thinks they're beautiful. Well, then they develop this relationship. And it was several years ago, it was probably about 4 or 5 years ago, we had the very case happen. This young girl from Mississippi met a guy on Facebook. He was able to get her here on the bus. Once she was here, she was sold to a pimp here in Cincinnati. What ended up happening is that one of the officers that we work very closely with in Cincinnati knew there was a problem, pulled over her and the pimp, got her out of the car, got her back to the cruiser and said, hey, do you need help? And she said, yes. So what she was told the pimp, what they were being pulled over for was she had an outstanding warrant, because you want to protect them as much as possible and know that in healthcare that their boyfriends are going to be sitting right in the room with you. And he's going to call her honey and he's going to be all loving on top of her. But if you are seeing a person there that's maybe drug addicted, you always have to question the person in the room if they are not the perpetrator. So kidnapping, it's really like less than 1% is kidnapping victims, just FYI. Children is a much different story. No, with adults, it's not a rescue mission anymore. Many of them do not believe they can leave their situation. So what we have to do is build trust in that relationship as a healthcare provider and the patient to build trust. And you may have to see this person over and over and over again before they trust you enough to say, this nurse, this provider, this person is kind to me and does care what happens to me. But they're going to show up with attitude. I promise. I promise more than anything. They will come with attitude. What you're going to see is a lot of delayed presentation for healthcare. STIs out of, multiple STIs, multiple bruising. You might even see cigarette burns. You might see ligature marks. You might see it around the neck. You might see it around the wrists, those kinds of things. You may see very scripted. So if someone comes in the emergency room and they come in alone, you're asking them questions. They're on the phone getting the answer. You've got to ask yourself what's going on there. He might be sitting outside watching, or she might be sitting outside watching and wanting to make sure what happens is only what he says or she says the victim can do. Look for branding. Branding goes back as far as slavery. Women were branded on the breasts during slavery. And people are branded even now. So if you see someone who has a lot of skull and crossbones, and it looks very, just kind of black, white, and gray tattoos, but you have one cute tattoo that's got a heart and it says property of, that might be a branding tattoo. So a lot of property, it'll say moneymaker, king's girl, a lot of crowns. You see a lot of crowns and stuff. So a lot of stars too. We see a lot of that. Also, you want to really look for, like I said, ligature marks, evidence of torture. What what they don't want to do is hurt their merchandise, so to speak. So they'll try to hurt them in places that's not real visible. Bottoms of feet, across the top of the buttocks, maybe, different things like that. So just know, sometimes you just have to ask the question. Those are some of the tattoos. This is more the more of the CPT code here, not CPT code. What am I trying to say? You see that mostly in Europe. You don't really see mainly see a lot of crowns here. Ligature marks, more sign of torture. Ligature marks, wrists, ankles, neck, bruising at the corner of the mouth. So that means somebody was gagged. So just know that. Burn marks, signs of strangulation, fingerprints, what things might look like fingerprints on the neck. Pinching seems to like be something, and a lot of times just a lot of black eye. Excuse me. What I've discovered, what I have really discovered is even if someone looks horrendous, like they have been to hell and back, like they have just walked out of the zombie apocalypse. And when I say that, I don't mean that to be funny, but I work with a couple of women right now that have been out on the streets for so very long and have been trafficked for so long, and they're so drug addicted. They look completely unhealthy. And you would think someone would not be willing to purchase this person. So no matter how much bruising there is, once it gets dark, she has business. During the day, she doesn't have as much business. And she will be the first to say, during the day, I don't get much business, but at night I do. When the lights go down, people will still buy her, and she looks incredibly ill. And very cachectic, and you could count the bones in her face, and it's sad. So by this point, by the time I see the people I see, many are very malnourished. They look like they have multiple skin injuries, skin issues, abscesses, all those things. So those are all things that you see. Just know that they may lack documentation. A couple of years ago, we had a young woman who her mom brought her here when she was 19. She had been trafficked since she was 4 and was all over the country. And when she turned 19, she was sold to a pimp here at Cincinnati. And the problem with that was when she finally got help and was able to get help, and she got help because she tried to kill herself. And so then people began to help her. And it was hard to find out because she didn't even know what state she was born in. So know that this is not an adult issue. It is actually a child issue. I know we think these adults can just leave their situation, but when your whole worthiness happened at 4 and 9, I have another young woman I work with who was 9 the first time her own parents sold her. So familial trafficking in Cincinnati is a big deal. It goes on a lot. It goes on a lot in the Appalachian communities. So just know that if your grandfather is sleeping with you and having sex with you, your worth is based on sex. And that transition, that drug abuse transition into trafficking happens very easily. A lot of the women we see out on the streets, they will be bipolar, schizophrenic. Many have been diagnosed, many have not been diagnosed. They're hypervigilant. And what I mean, they're hypervigilant at times. And what I mean is they're for sure that you're going to judge them. They live in the shame and blame game. So they're already hyped up and is worried, they are absolutely concerned as to what you're going to say to them when you do the assessment in the emergency room. You're going to assume they're a drug addict. You're going to not be kind to them. And so I want you to remember that words are everything. Words are everything. And so once they feel slighted, they would soon die as to go get medical care because people don't treat them nice. And yes, do they have coping strategy issues? Yes. But they've been a victim for 14, 15 years. And we have some women who are just getting off the streets that are 60 years old. And that's a sad state when we have women who are being trafficked at 60, or women who are in a wheelchair and in her 50s. So and that is a sad state of affairs. Lots of things to talk about. I always say shame and blame are the key things here for the people that I work with. And we have a lot of barriers to disclosure. Lack of trauma-informed policy and care. I'm going to tell you, what helps is as we advocate, if we can stay the whole time when we're taking someone to the emergency room, we will. I drop my card off with the person. If I can stay, I'll stay. If I can't, I can't. But if they know they have an advocate, then that gets them much better health care. And I want you to always remember, especially with children, for children, we're mandatory reporters, but, once they reach 18, you can be 17,364, and it's a mandatory report after that. In Ohio, it was just maybe about 18 months ago. The pandemic kind of messed me up. I kind of forget what year, but in the state of Ohio, from 16 to 18, you had to prove force, fraud, or coercion. But you didn't automatically treat a person who was 17 or 16 like a victim. You treated them as a criminal and arrested them as a criminal. So they did pass a House bill, I think it was like 18 months ago, where now anyone under the age of 18, you do not have to prove force, fraud, or coercion in the state of Ohio. So, and what I want everyone to really understand is compliance does not equal consent. Because someone is consenting, compliance, let me back up. Compliance just means that they are following the commands of someone else. If a trafficker, when I showed you the picture of the people, of the man who had the women over in Avondale, 12 women in a house, there were bars on the door. There was padlock on the refrigerator. So if you have someone who controls every aspect of your day, like literally when you use the bathroom, when you eat, what you eat, how many people you have to have sex with today, what kinds of sex acts you have to do today. If that person controls every aspect of your day, you will never, ever be able to make the judgment yourself that I can leave the situation, because everything you do needs permission. So I want you to remember that. And even with women who are experiencing domestic violence, we see a lot of the crossover between the two. We see folks that are often, we think are actually victims of domestic violence when they're actually victims of human trafficking. So use interpreters, but we know that in the hospital, right? For everybody who's already in the hospital, that's what we want to do. And like I said, we just mistaken lots of them for domestic disputes. One term I hear occasionally out on the street, which I find kind of appalling, but they do call him daddy a lot. And so you may come across that when somebody says, my daddy's coming and he's coming to pick me up. My daddy's coming. It may not be her daddy. It may be the person who's trafficking her. So know that that it's not always a loved one. Sometimes they might have just a separate handler, their boyfriend. It could be a female, one of the bottoms that come into the hospital with them or into the clinic with them. You know, I always want to honor advocates at the bedside. I absolutely do. But I think what you have to do is try to interpret what's going on. And is that advocate an advocate, or is that advocate harming the person? And just try to do an assessment separate. And I used to say in the emergency room, say you got to go get an x-ray, or you got to get a scan, or do something that can separate them, even if it's just for a few moments, that you can say, hey, are you safe? Are you okay? And if you can't tell me right now, that's okay. But no, I'm here if you want to come back again. It's not going to be an immediate rescue. You're not gonna be able to rescue someone immediately. You can befriend them, build their trust, and then they have to know and believe that they deserve better in order to make that change. And when we talk about trauma-informed care and why that's so important is it takes a lot of patience. I actually, when I started out on the street, I became a volunteer at End Slavery Cincinnati. I went on their outreach program. We'd go out late and we'd have a van and we'd jump out of the van and we would just talk to them and ask them if they needed anything, give out goodie bags, you know. And as I got to work more, I was at a human trafficking event where a Cincinnati police officer was there, and I said I was a forensic nurse, and she asked if I would be willing to come and help try to help some of these young women, advocate for them to get medical care, to go to the hospital if they need it, because they hate going so much that they would soon let their arm rot off with a huge abscess than go to the hospital. So I actually started out there with just the backpack. I started going between Tamar's Place and the Women of Alabaster. And those are two faith-based NGOs, non-government organizations, who are out there just trying to help in any way they can. And so when I first started, there was one particular person, and she just wanted the Women of Alabaster director, Scarlett, wanted me to see this person. And she ran every time I walked in the building. She literally ran every time I did. And it took 10 months. And so finally, she asked me to help her. And she had wounds all over her body. And I thought it was pics. You know how people are coming off and they're meth is kind of their drug of choice, and they pick their skin because it feels like their skin's crawling. And so I thought that's why she had pick marks all over her body. And so as I'm cleaning them and dressing all of them and putting triple antibiotic, because that's about all I had in my backpack, I asked her, I said, you know, you don't have to answer any questions, but I'm going to talk and I'll ask you some questions. And if you don't mind, if you don't want to answer the questions, just tell me you don't want to answer that kind of question, and I won't answer that. I won't ask them anymore. So I said, you know, I asked her drug of choice. And with her drug of choice, I thought she was going to tell me meth, but it wasn't. It was heroin. And I was surprised. And I told her that. I was just honest. And I told her. And she said when her mom first started selling her at 9, she would pick her skin until the men were done. It distracted her. And she still does it to this day. So she is a success story. I'm crossing my fingers. she kind of, what happens is, it's like with anything, they slip back into the dangers again, over and over and repeatedly and repeatedly. And they end up back out on the street again. We just don't have a very good social system for it. You know, we need to do more upstream thinking than downstream thinking. We need to start with our children. We need to create the resilience in our kids and have lots more programs for our kids. And then we might not have so much drug addiction and then so much sex trafficking. I'm always shocked, though, to be quite honest with you. You know, it's not junk cars that come and pick up somebody. It's the guy in the Mercedes. It's the guy in the BMW. It's the banker who comes at lunch. These women that I work with are the busiest right before a man goes to work and right when he gets off work. And they want to make sure when they would come see us and come in the building, they would want to make sure that they were out on the street between 3 and 4 o'clock. They wanted to make sure they were out there so they could get business. And I think that's kind of a sad state of affairs where, you know, I'm a feminist, and I think we're going to see lots more sex trafficking. It's going to get bigger and bigger. We have a lot of demand here in Cincinnati. We would not have what we have going on in Cincinnati if we did not have the demand. And I don't think people are really scared of arrest. I'm pretty sure they're not. You know, women are arrested in criminal court. So if you're picked up for prostitution or solicitation, you are picked up in criminal court. If you are picked up and you're a John or a lick, because that's the vernacular, right? They're either called a lick or they're called a John. If you're arrested in the same incident that the female is for prostitution or solicitation, the man will, it's in civil court. He gets a ticket. He gets to go home. She goes in handcuffs. Now they tell me they're not really arresting people for solicitation and prostitution anymore, which is not really true. But you don't hear about the civil tickets given out. So I'm always curious to hear about that, because when you go on any of the websites for the police department, you know, they don't want to talk about the elephant in the room. They don't want to say what the problem is. So human trafficking or domestic violence, this was created because it's about power and control. You know, what it looks like if you're being perpetrated on by your spouse or your boyfriend, your significant other, or if you're being perpetrated on by your trafficker, pretty much the same. It's all these things, the intimidation, the coercion, economic abuse, emotional abuse, isolation. That's how they get these very young teenagers. You know, they talk them into sending a shot in their underwear. Send me something in your underwear. So they try to get them in a way. Then they finally get them. They coerce them and they talk them into being naked. Be naked. So guess what? Then they use it. They use that power and control, or else they're going to put it on Facebook. And we see a lot of situations with our young youth, our high schoolers, our preteens, who are falling into that trap of social media. And with the new use of AI these days, I'll tell you, you don't know what story is true and what story is not. I think we're probably going to have to create some integrity laws. It's a shame that we would have to have some integrity laws, but I guess if we're buying human people, we don't have those integrity laws in place. So questions to ask. You know, some people just need someone who's kind to them. Someone just needs to know that someone cares Someone's not judging them. I occasionally give a talk with a young woman who was out on the streets for many years, and now she's off the streets. She's a director at a local agency. She does absolutely wonderful work for herself. But what she talks about when we would give talks together is when I come into the emergency room, I know I look bad. I know I'm not acting good. I know, because if you've ever seen somebody who's dope sick or who has speedballed it for 3 or 4 or 5 days, their neurologic system is so messed up. They are firing, their neurons are firing like crazy. So if you see the folks out on the streets who's doing the constant movement, they're bending all the way down, they're standing up, they're doing this, they're doing that. That's the assault on their neurologic system from all this drugs. So they know they're acting that way, but they can't control it. She said, don't have all your friends in the emergency room parade past my door to look at me, because that's what happens. And we know that kind of stuff happens. You know what, when you're near emergency room, I worked at UC for a lot of years. I was there for 14 years and I worked in surgical trauma, and then I became the house supervisor at night. So guess what? You do see some of the most unusual circumstances that draws people's attention. But if we're truly going to take care of these people, she also said, when I sign my discharge orders, you don't, in the day when we used to sign them, she said, or if I asked to use your pen, I've seen people throw the pen away after I've touched it. And so she would talk and she'd say, know that I am struggling. I know I am not acting right. And so know that as you go in. And yes, are they going to probably be mouthy? Yes. Are they going to potentially be derogatory? Potentially. They are already armoring up, as I call it. So when they armor up, they're protecting themselves from your words. So know that. And I always think it's really, we in the hospital system, we think they're out for our drugs, right? They're going to ask you for stuff, but they call it getting well. So what happens if I'm advocating for someone and I am going to take them to the emergency room? They will say to me, give me a couple minutes, I got to go get well. What they mean is they are going to go and shoot up with some heroin. Now it's fentanyl. Now it's the new drug xylene. Am I saying that right? I don't ever know if I say that word right. And what they're going to do is they're going to go get well. And then once they're well and they have enough drug on board, they're going to let me take them to the hospital or let them take me. We kind of bring them to CHN because here at Cincinnati Health Network, you don't need to be an existing patient to do a walk-in. We allow people just to walk in and become a patient at that moment. So a lot of the young women I work with come here, and our advocates at Josephine's clinic bring them here for care because we do dental, behavioral health, psychiatry, and primary care here all in one building. So that's what I want to instill, is that our folks really have a lot better drugs right out in their car than what we're going to give them in the hospital. We might give them morphine, but they really like heroin and fentanyl better, and they're getting it really easily and quickly out there. So just know that when you see some of these folks. And we also take care of a lot of transgendered folks, and our transgendered folks, they're in particular danger out there, and they are in particular danger of being killed. And so sometimes it's just a little respect goes a long way, and talking to them like you would talk to somebody who has a lot of money. And because you know how it is when you work at the hospital and someone who donates a lot of money, they call you as a supervisor and they say, hey, this person's coming in. I want you to go check on them. Pretend these women is that person. Go check on them, see how they're doing, offer them something to eat. If they're dope sick, if they've come because they've overdosed, they're not pleasant people to be around. But try to take that in stride, because they have been to hell and back. And when you've been out there as long as some of these young women have been, it's pretty devastating. They're used to people treating them bad, but when they come to healthcare, let's not treat them bad. Just remember, your trafficker, man or woman, pimps, dope boys, gang members, drug dealers, terrorists, and your neighbor. And I say this over and over. Traffickers don't always look like traffickers. They don't look like the bad guy all the time. I say this with human trafficking, labor trafficking. If you live in an affluent neighborhood and your neighbor has a maid that only comes and goes with the neighbor, or doesn't have a start time and an end time, right? Everyone starts work at a certain time and ends at a certain time. You got to ask yourself what's going on there. So just be aware that it's the teacher in school. It's, as we've seen with Judge Nolan, it's everybody and anyone. So I don't ever want anyone to think that that the image of a trafficker is some scumbag, because it's not always that. It is, we heard in Portsmouth, Ohio, it was the prosecutor there, it was the judge there, it was everyone there. They had a nice little system there. They'd arrest somebody for a teenager for marijuana and make them think they were going to go to jail for 5 to 8 years. You say that to a 15-year-old who's poor is going to do whatever you want. So I'm always, I think we think certain folks in our society have integrity and they wouldn't do it. But I think when money talks, people listen and people do things they wouldn't normally do, So let's talk about trauma-informed care real quick. Safety, trustworthiness, transparency. Be their peer. Ask them their opinion. Ask them, do you want to do this? Hey, I've got these choices. I see that you have an abscess. Do you think you can stay in the hospital? Maybe they just can't do it, but they could agree to come back to primary care for help. I know many of our young women have had to come to the hospital because they end up with a huge endocarditis. It's common. One young woman I'm working with, she has been in the hospital multiple times for endocarditis. And we know at some point that could be the issue that they have to come in. But I think if we talk to them and give them voice and choice, because remember, so many of their choices have been taken from them. So when someone is controlling them, they don't always have the right to make their voice and choice heard. But when they come to see us, let's try to give them that voice and choice. And we have a lot of cultural, historic, and gender issues. I can't know every single cultural thing about somebody, but I can Google. I can say, oh my gosh, real quick, hey, they're from this country. Okay, let me try to find out a little bit about them before I go into the room so I can be respectful to them, so I can know how to treat them. So I think that's when you win people over. Patience, patience. You need it. It's going to take 7 times 7 ways. We say that about domestic violence, right? It's 7 times 7 ways before they actually leave their significant other. It takes a lot to leave. And just know as it is when domestic violence, especially for some women, that this becomes the most dangerous time in their life, right? When someone leaves their significant other who's been an abuser, that's when their life is at most danger of being killed. And just know for these women, their life is in most danger at this time. Again, building trust, it takes time. And then understanding the neurobiology of trauma is huge, is absolutely huge. You have to understand that when a trauma occurs, the prefrontal cortex shuts down, your amygdala, which is your threat assessor, it says, okay, I'm in trouble. You put your hand on a burner and it remembers that you don't touch a burner again. So for these young women, you think to yourself, why does this keep happening? Why does this keep happening? Because they have had this complex, continuous trauma for such a long time, it's no longer a threat for them. So they end up, their amygdala is no longer assessing it as a threat. And we know that the amygdala takes control. Once the prefrontal cortex shuts down, the amygdala takes control. So the whole flight, fight, freeze, and dissociate. Lots of rape cases are not prosecuted because the person didn't fight back, but your amygdala takes over and it says what you're going to do. So you don't necessarily have control over that chain of events and that mechanism. So understanding that when someone comes in and their perpetrator just beat them up, they could have an absolute huge rush of oxytocin because that's part of your hormones that are released during trauma. You get this huge rush of oxytocin. And so what does she say? But he loves me. Our body creates an environment of survival. And so those hormones are released to save us. But what do we look at it as? She is crazy. I can't believe she's going back with him. I can't believe she said that. And we all know we do it. But if we can truly understand why the brain does what it does, I think we can give tons better care. So I encourage everybody to learn as much as you can about the neurobiology of trauma. And I'm trying to watch time here. I got 5 minutes. Learn as much as you can about how the brain works during trauma. It's so incredibly important. And it's so incredibly important, not just for healthcare, but for law enforcement to understand that when a trauma happens, I always describe the prefrontal cortex as a bunch of Post-it notes. Your vacation is all the orange Post-it notes. Your dinner tonight's the green Post-it notes. Something else is the blue Post-it notes. Well, when a trauma occurs, the Post-it notes hit the floor and they're all jumbled up and they're no longer in order. And sometimes you lose a couple of Post-it notes. So memories come back slowly. Everything comes back slowly. And sometimes some memories don't come back and they don't come back in order. So what happens when someone's interviewed? They do not tell the story in chronological order because their brain hasn't put it back in chronological order. And what do we accuse them of? Lying. We do it all the time. The court systems do it all the time. And that's why it's important to learn this aspect, because when we take care of people that have complex trauma in the hospital or come in with a trauma, a current rape case, that's why it's important to know how your brain reacts during this. And it allows us to give a lot better care. It really does. Mandatory reporting, anyone under the age of 18. You can only report with consent. You would never, ever, ever call the police if you have an adult in the emergency room that is there. And you think they're a trafficking person, and you would never do that. Because what you're doing is potentially creating a death moment for them. They could be killed. And remember, no one allows them to consent to anything. So let us be the first person that discusses their consent. End Slavery Cincinnati, Salvation Army, they just had their big conference. I don't know if anybody went to that. That was on last Friday. And then the National Hotline. Here's what I want you to know. The Salvation Army is a 24-hour hotline. Cincinnati has a wonderful city that it has an actual hotline. It actually serves Northern Kentucky and Southeastern Indiana as well. There is a person 24 hours on call, 7 days a week, 365 days a year. If you have a person that you think is trafficked in your healthcare setting, you can call them. You can say, hey, I've got this person. I don't know what to really do. I went to an education about it, but I don't remember what she said. You can call them and say, hey, what questions should I ask? What should I look for? You know, will you come and make an assessment? Can I offer your services? You know, ask for Salvation Army and Slavery Cincinnati, their person to come. They'll come to your healthcare setting. They will help set up resources. The National Hotline, COVID really did a number on them. Still call them. But what they do is they send resources. They'll send the local FBI folks. They will send local law enforcement. And it's not an immediate assistance. Just know that. The National Hotline will create a situation for investigation and not really for immediate assistance. Our Salvation Army here in town is immediate assistance. Questions? And did I see Amy Costanza in the audience? Did I see Amy?
Yes, I'm here. I was trying to send you a chat. I learn something new every time I hear you.
Hi, how are you? It's been a while.
I know, and I'm so sad that it's still such a huge problem.
I think it's the pandemic made it a lot worse.
That was my question.
Yes, ma'am.
Did COVID decrease law enforcement and attention because nobody was getting out there?
It was, and it became easier to conceal.
Yeah.
Everybody was, when officers are out on the street, and even EMS is out there, and they see things, the nefarious going on. But when everyone was behind closed doors,
Right.
lots went on behind closed doors.
Yeah, it's sad. But thank you for all you do.
Oh, thank you.
Other questions? We'd be happy to take more if there are any.
Trying to see if I knew anybody else. Oh, I see someone else I think I know. Oh, maybe not. Sorry.
A question too.
Is Jennifer Fields? Is that Jennifer Fields? I'm calling people.
Yes, it is.
I'm calling people out that I know. Sorry. How are you?
All right. This was very good.
Oh, thank you.
Looks like somebody wants to know more about the Josephine House.
Oh, Josephine's Clinic. We are located at 106 East McMicken. It used to be Philippus Church. It is now Over the Rhine Community Church, and we are on the 3rd floor there. So we share a space with the organization Women of Alabaster. And so we're kind of the healthcare side. She's the side that we feed people daily. We get people fresh clothes. Underwear and socks are like, godsends, because if you've gone and you have had sex with people for 5 days straight, maybe 10 people a day, and you don't have fresh underwear, it's like getting a chocolate bar. It's the best. So we try to give out lots of underwear, lots of socks. We give out lots of condoms, but we get that from Caracol. They keep us in harm reduction. Shout out to Caracol because they make sure we get the Narcan we need, and we carry Narcan everywhere we go. So we are located with them. We try to just get them services, and we get a lot of those services from Salvation Army and Slavery Cincinnati. They have case management there. So what we just try to do is show people that they deserve better, to get off the street, also advocate for them in healthcare. You know, that's a big deal. And mental health services, that's kind of what we do too. We dress a lot of wounds, you know, out on the street. You know, your pimp's not going to give you Tylenol if you got cramps. He's not going to give you Advil if you got cramps. So we give out a lot of little stuff like that. We give out antacids. As you can imagine, their eating and nutrition habits are pretty terrible. And, you know, as a small organization, we feed a lot of pasta. I'm not going to lie. Pasta goes a long way. You know, and so we could probably do a little better financially if we had a little bit more money, but we're trying to feed the masses. So that's kind of us. We have outreach that we do. So we'll go out on the streets. We're doing on a Wednesday night. Apparently on Tuesdays and Thursdays, they're doing a sweep through OTR, special operations with CPD is. So everybody goes in and, you know, all the places where the trap houses are, there's no one in front. So we picked another day. So we're going to start on Wednesdays now. And we just go out and give out goodie bags. In wintertime, we give out sweatshirts, hats, scarves, coats. We just carry them around in the car in my truck. I drive a truck, and we just pass them out as much as we can. So we try to do those. It's a food desert, so we try to get them a snack and water, hydrate them. So we'll give out waters. So we just kind of, you know, we're real street level. We're like boots on the ground. We're not fancy. So we just carry a backpack with wound care supplies, lots of Narcan, lots of condoms, and then we give out goodie bags. It's kind of pretty simple.
Do you have anything in the Dayton area?
We do not. I'll tell you what, we had a big volunteer force, and we are 100% volunteers. We pay no one. And the COVID really hurt our volunteer forces because we had retired nurses. We had retired EMT. We had a lot of people who were retired who would come during the day. COVID exhausted everyone. And so we really work really hard to staff, but there are some days we can't staff a nurse or a healthcare personnel to help with that. So it's kind of give and take with that. So
How are you funded?
Word of mouth. So we don't have any really big funders. One of our big funders, and I always get their moniker wrong, but they are the Imperial's Queen Court of the Buckeye Sovereignty. I forget all the parts of it, but they do a lot of drag shows for us, and they have been a godsend for us during this. And they actually help me pay for my rent. So we do a lot of things like that. We do fundraisers, magnificent giving at schools, where the schools interview people and they decide who's going to get the money. That's been really big for us. It seems like in the last 3 years, at least one school has picked us. So, and then people hear about us, or I give a talk, and then people Venmo me money, and that's kind of how it's been. We're trying to get a little more organized, so that we are purchasing a not-for-profit platform that tracks everything, because when you know how it is when you're applying for grants, they want to see exactly what you spend, you know, where it goes, what you need money for. So we have just purchased that platform, and so we're trying to take it to the next level. So, but that's kind of where we are. We started in 2017, so we've been out there just a little bit, but you know, all takes a little time, I guess.
Awesome. Any other questions? Okay, well, seeing none, thank you so much again, Roseanne, for your time. We truly, truly appreciate